If you're currently not using social media as a healthcare provider as a way to market your practice, services, and staff, you're behind the times. I'm not saying that to shame you, instead I'm saying that more to persuade you to use it. When I ask providers why they don't use social media as a means to get the word out about their organization, they usually give me one of two answers. Either they don't believe that their patients use the social web, or they think it's too risky. But Facebook saw 2.6 billion monthly active users in 2020, so it's impossible to say that your patients don't use social media in some way, even if you work within geriatrics. Let's say the reason why you don't use these platforms happens to be the former. It puts too much risk on your organization. If that's the case, you're watching the right video. Hi everyone, I'm Matt from eTactics, and today I'm going to explain the 5 biggest challenges of social media in healthcare. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. The biggest challenge of using social media in healthcare is the legal ramifications associated with it. The reality is that the HIPAA privacy rule strictly prohibits the use of PHI on social media. Thus, you need to have absolute certainty that there is not even a hint of sensitive information in everything that you post. Otherwise, you'll face a HIPAA violation because of the activity on the social web. The last thing you'll want to deal with during your extremely busy work week is sorting out an audit with the government. The second biggest challenge is reputational damages. Anger spreads faster through online communities than any other emotion on the spectrum. While these platforms provide a central connection hub for people across the globe, they can also lead to bullying, virtual witch hunts, and victimization. In fact, most people don't think that these services provide any benefits at all. 38% of adults see social media as harmful in nature. Furthermore, almost half of all consumers use the social web to call out brands. Outrage has already happened to content that healthcare professionals have posted on social media accounts. In some cases, it was so bad that the provider who published the content that faced criticism walked away from the platform altogether. The next challenge I have for you is battling low-quality information. As a healthcare professional, you probably already know that this problem exists due to how many patients come into your office explaining how they've self-diagnosed themselves on search engines. MIT found that falsehoods are 70% more likely to receive a retweet on Twitter than the truth. What could happen is you find some information or a video that's interesting on your feed and reshare it with your audience without a second thought. The content you reshared looks legitimate, so you don't think that much of it. If that happens and people find out that you shared false content at one point or another, your entire credentials could be in question for resharing it. Fourth, using social media is time-consuming. Managing the content, your accounts, and interactions on each of your platforms is a time-consuming process. It takes time that you might not have throughout your week, especially if the statistics about burnout rates in your industry are true. Now, around a quarter of marketers spend somewhere between 6 to 10 hours on social media marketing per week. Now, maybe you could get by only spending 1 hour or so on your accounts per week. However, what you put in, you'll get in return, so spending that small amount of time probably won't result in that much of a return for you. Now, the final and fifth big challenge of using social media in healthcare is saturation. If I published this video in 2010, this section wouldn't even exist. We're here 1 decade later, and there's a total of 3.5 billion users scattered across all these different channels on the social web. When first starting out, a lot of healthcare professionals will spend hours upon hours researching the different channels to try to figure out which one they should start at and which one they should post on the most. Although that's what they should do, it's also where their research ends. Instead of spending all of your time trying to figure out which platform to start and why, you should also spend a lot of time drafting out your strategy for posting across all of these platforms. Oftentimes what happens is organizational leaders will dive right in, expect results, not get them, and then give up on social media altogether. Think of starting your social media like starting a restaurant. If you don't know it, 60% of restaurants fail within their first year. So why do they fail? It's not because they don't meet federal food standards. They fail because they don't know what it takes to succeed. Thus, it's all about the strategy you come up with, not just where you start. Now, I'm not trying to dissuade you from using social media as a healthcare organization or a professional. This video is created to shed some light on the fact that there are some real challenges that you'll face throughout your journey, some of which happened before you've even created your accounts on a platform. So now that you've watched this, you can officially make your decision as to whether or not social media is the right place for your organization to advertise itself. If you'd like to learn more about challenges on social media, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.